This MCQ gives you a kind of an overview that what we call in my lectures as horizontal integration. Why? Because I'm telling you that this topic of CRPS is actually a topic of medicine. It is a topic, I mean, honestly, it is a topic of anesthesia also, since it has pain. So, how we have collaborated it with orthopedics in the form of Sudeck's dystrophy, that is something which you people have to do as a PG aspirant. That when you see an MCQ coming from different domains, different orthopedics, different branches of medicine, you have to scratch your gray matter and club all of them, combine all of them, concise all of them, so that you can remember it in the most palatable, easy way. Right, so let's talk about this important MCQ. Elderly female sustained Colles fracture in a right hand, right left doesn't matter, which was properly treated. After treatment, she complains of stiffness and severe pain in the wrist with cold sensation, trophic changes, and cyanosis in the fingers. All right. X-ray done again shows decalcification. Some calcium has been taken out. She is most likely suffering from causalgia, tubercular arthritis of the wrist joint, traumatic tenosynovitis, Sudeck's atrophy. Maybe some of you are finding it weird to read even the options that what have they written. That's fine, we'll solve it. So first of all, I would like to pinpoint here that it has nothing to do with tubercular arthritis of the wrist joint. No evening pyrexia, no loss of weight, no loss of appetite, no predisposing feature of tuberculosis, and how tuberculosis can happen after Colles and that to treatment. I mean, there is nothing that can connect these two. So let's just rule them out. Traumatic tenosynovitis, I mean, inflammation of tendon and the synovial sheath of the tendon after trauma, decalcification of the bone. I mean, they don't make any sense at all. So answer can be causalgia, answer can be Sudeck's. अब ये क्या है कि ये बड़ा सुना सुना लगता है MBBS orthopedics final year, Sudeck's, something called Sudeck's. Don't worry, we'll make it simple for you. I will not say that this is a term of orthopedics, but this is a term of medicine, anesthesia to be precise, called CRPS. Let's understand what is CRPS. CRPS is called as complex regional pain syndrome. All right. CRPS is complex regional pain syndrome. First of all, the word complex wants to tell you that the etiology is very complex. Not many people have been able to understand. Regional, because a particular region is involved. Pain, because pain is the superstar feature, the poster boy symptom of this condition. The syndrome means a cluster of other symptoms together. Don't worry, I will explain again. If there is a complex etiology of pain and many other symptoms in a particular region, that condition is combined together to be called as CRPS. Now, this CRPS is of three types, but I will not go into the third type. There's no need to do that. Basically, you should remember that CRPS is of two types. One is type 1, the other one is type 2. And now we'll try to understand what is type 1, what is type 2. The reason behind pain, listen to this carefully. The reason behind pain can be either a nerve or something which is not related to a nerve. पेन के पीछे का जो कारण है वो एक नर्व हो सकती है या कुछ भी हो सकता है which is other than a nerve. If the reason behind the pain has an association with nerve, then we call it CRPS type 2. And if the reason behind the pain has an association with anything other than the nerve, that is what is called as CRPS type 1. Now, this CRPS type 1 is called as Sudeck's osteoneurodystrophy, also called as reflex sympathetic dystrophy. While this is what is called as causalgia. Are we able to understand this? So, CRPS is of two types. If the reason has something to do with the nerve, we call it CRPS type 2, which is causalgia. If the reason behind the pain and various other symptoms is anything other than the nerve, it's not a nerve, then we call it CRPS type 1. And the classical example to explain that CRPS type 1 is Sudeck's osteoneurodystrophy, also what is called as reflex sympathetic dystrophy. Now, in this question, whatever is happening after fracture, and I think fracture happens in a bone, and I think bone is not a nerve. So, answer has to be Sudeck's. But what precisely is Sudeck's? We need to understand. Although on my YouTube channel, I have done a full-fledged video on Sudeck's osteoneurodystrophy with a lot of detail as well. But let's try to understand the fundamental behind Sudeck's osteoneurodystrophy. So there is over-sympathetic stimulation is the key word. Nobody has been able to crack as of now that why this happens, but one thing is for sure that there is uninhibited, uninterrupted, uncontrolled, unregulated over-sympathetic stimulation that happens. We have three types of nervous system: PNS, CNS, ANS, peripheral, central, autonomic. Autonomic further has two: sympathetic, parasympathetic. So in this condition, you have oversympathetic stimulation. Usually there is an association with Colles fracture, and despite proper treatment, this happens. Now, what happens because of this oversympathetic stimulation, we need to understand. The thing that happens because of this oversympathetic stimulation can be understood in the form of a mnemonic, and that mnemonic is what is called as, come on, speak up everyone, shop. You can call it shop, you can call it posh. Okay, let's call it shop first. So S H O P. Let's first explain P, pain. And this is not a normal pain, it's a severe pain, it's a burning pain, it's an intense pain. It's a pain which is out of proportion to anything coming its way. People try oral analgesics, intravenous analgesics, intramuscular analgesics. Pain is not going anywhere. So this severe burning, intense, out of proportion pain is the first point of Sudeck's, followed by swelling. These are trophic changes that happen due to oversympathetic stimulation. Not only swelling, you will have a lot of stiffness of the wrist. Not only that, you will have a thin, shiny, stretched skin. No wrinkle, no creases, nothing. Old lady, post-Colles, 50 plus, skin is absolutely shiny. H, hyperesthesias. I mean, even if somebody touches with a wisp of cotton, it feels as if the other person has blown a hammer on it. So, altered sensation, hyperesthesia. O stands for osteopenia on the X-ray, which I have already told you in the question. If you might have noticed that there is decalcification, that is nothing but osteoporosis, but please try to understand why. I give you a very simple logic today. What happens when you see a lion? Which system gets activated, sympathetic or parasympathetic? Sympathetic. Fight, flight, fright. Now, when you see a lion, you see oversympathetic activity in your body, and my next question is, what happens to the blood supply? The blood supply is increased. Till the lion eats you, it will increase. So here also, since there is oversympathetic stimulation, so don't you think that there will be excessive blood flow in that area of wrist? Yes or no? Yes. So this area has an excessive blood flow which is taking calcium from this part of the bone proximally and distally, leaving behind decalcification patches, leaving behind osteopenia. So this excessive blood flow mobilizes calcium from that area to proximal and to distal area, leaving behind deficiency of calcium over there. So we have come to the conclusion today that Sudeck's osteoneurodystrophy is not a clinical, it is not a radiological, but it is a clinico-radiological diagnosis. We have come to the conclusion it is not a clinical or radiological, but it is a clinico-radiological diagnosis. That is what I want you to understand. Now, as far as management is concerned, just remember one very basic thing, that you can start with a group of medicine called as sympatholytics to break sympathetic activity. You can go with sympathetic ganglion block. You can, block the sympathetic overactivity, or you can go for surgical sympathectomy. But come what may, I can tell you one thing very clearly, that it has a poor prognosis overall. So if I go back to the question from which we started our journey, I cannot call it causalgia because that is something which is related to a nerve. So answer has to be, come on, speak up everyone, Sudeck's osteodystrophy or Sudeck's atrophy. So this MCQ gives you a kind of an overview that what we call in my lectures as horizontal integration. Why? Because I'm telling you that this topic of CRPS is actually a topic of medicine. It is a topic, honestly, it is a topic of anesthesia also, since it has pain. So, how we have collaborated it with orthopedics in the form of Sudeck's dystrophy, that is something which you people have to do as a PG aspirant. That when you see an MCQ coming from different domains, different orthopedics, different branches of medicine, you have to scratch your gray matter and club all of them, combine all of them, concise all of them, so that you can remember it in the most palatable, easy way. So I hope this video helps you in your preparation of this topic. Thank you.